So this is exam one, NUR203 exam one. It is pretty heavy on the theorist, so pay attention to that. As I was just explaining, make sure you know the names of what each category is, not only knowing what does autonomy mean on a toddler or what does industry mean on a school-age child. And I'm going to go into those. So let's go get ahead and get started. Now, I just redid this PowerPoint, went over it slide by slide to make sure that information is here and those concepts. Remember, there's Cahoots. They're going to, really check your concepts, all right? And the PowerPoints every week. I actually do PowerPoints and reviews and the exam review. So I do all of those things. So I know your concepts are going to be around. So here we are, just Erickson. Now, these are those 5 stages that you need to understand. So let me just go over them. There's going to be a couple slides about them, but this is the one I'm going to focus here. Trust versus mistrust. What does Erickson say? This is all about psychosocial, all right? So how you think, how you relate to things. Now, what does an infant do? All they do is coo and cry, right? That's how they express themselves. Well, trust means that baby cries, somebody goes, picks them up, feeds them, changes their diaper, or gives them love. So they're happy, healthy, well-rounded, contented infants. A child who, due to whatever reason, could be due to their economic situation, could be due to abuse of, physical or abuse of substance, they are not picked up as much. Or sometimes they're let to cry to the point where they stop crying. And that is mistrust. That'll be that child who's more distant, not going to be that happier baby that you would see. Autonomy versus shame and doubt. Autonomy, automatically me, mine. It's a toddler. These children are all about me. They don't share and they don't share toys, but they want to do everything themselves. And they don't know fear yet. There's no filter. They've never been hurt. So the shame and doubt is when grandma, grandpa, mother, father, no, be careful. Don't do this. Get off. You're going to hurt yourself. They are over parenting maybe, and they don't let them to try things. How do you learn not to do something? When you do it yourself and you learned a lesson. So that is the shame and the doubt. Like, I shouldn't have, or maybe, or they're afraid to try. And toddlers are exploring the world. So you need to let them to a certain extent. Now, the preschoolers, initiative versus guilt. Well, this is now they're able to put their clothes on. They're able to go turn the bath water on or the shower and get in and pick clothes out. And they want to help mom. They want to set the table and put their clothes in the dirty laundry and stuff like that. But they can't do it all. So they take the initiative to do things, but they are also feeling they've not done enough. And that's actually sort of what their guilt is. Now, one of the biggest, and I can tell you on your HESI, on your NCLEX, you're going to always see trust versus mistrust and industry versus inferiority. Why they pick school age? Well, maybe because it's 5 to 6 years in span. So industry, what do I do well? Am I good at spelling? Am I good at math? Am I good at running? Can I hit the ball the farther than anybody? And I have a sense of pride. That's my industry, my factory, what I make, what I produce, that I do well. That's how I remember the word industry. My factory, I do it well. Well, what is inferiority? They cannot do everything well, can they? So when they can't spell, but they can do math, or they can't run, but they can do, other stuff, play the piano, they feel inferior because they want to do everything correct and right and the best. So industry, tasks they do well, and I feel really sense of pride from that. And inferiority, what I can't do, which I really wish I could. Now, adolescents are all about that change, right? From children into adults, and they're learning, what is my identity? Who am I? Do I like girls? Do I like boys? What do I be when I grow up? What college am I going to go to? What group am I going to hang in? What clubs am I going to join? All about, and then body image, what they look like. Are they happy with it? And there's all like this confusion, push from parents, push from peers, push from themselves, and that leads to all that confusion. Now, Freud's all about anything sexual, right? Oral, anal, phallic, latency, genital. It's all something related to that. Well, what do infants do? How do they self soothe? And that's with a pacifier or a finger or a rattle, anything in the mouth. They explore the world in their mouth and they soothe themselves. They're what my husband calls them a soother, which is exactly a great word for it. So, oral. Anal is because toddlers, well, the 2 to 3 year olds, now we're learning how to potty train. And we know that bowel training happens before the bladder. So anal, bladder, and bowel. So it is the bowel part of that. Phallic is all about now understanding girls and boys. And we know it has to do with boys like their moms and boys like their moms and girls like their dads. In my house, I always loved my dad, but I had 6 brothers, so he was happy. Latency. Now, this talks about growing up and being social with people. And we know school age children want to be with same sex peers. And that's the big thing about hanging out, girls with girls and boys with boys. And then we get into the adolescence, into that exploration, that sexual exploration in their genitals, figuring out again what their sexuality is, and then that experimenting about it. Kohlberg. Now, Kohlberg's all about right and wrong. And it's all about, as we get older, pleasing. Now, we know a good thing that you do, you're going to get a reward. That's the younger kid, 3 to 7. They get a reward. Before that, well, toddlers sort of know when they do wrong, but they don't understand the whole concept yet. It gets into the preschoolers where they start to know it's punishment for bad, reward for good. Now, getting into the school age children, that middle school age up into adolescence, they're pleasers. They want to please people. And that is doing good things. They don't want to do bad things. And then it gets up into the adolescence. And that's what society dictates. You open the door, you have manners, you wear clothes in public, you stop at a red light. These are all rules of public, right? You don't hit people just to hit them. This is all you've adopted the general society and what the right and wrong of that is. Now, Fowler's is mentioned, and it's mentioned in that children only know when they're small what their family sees. And it could be initially, it's the Easter Bunny and Santa Claus, right? As they start to get older and start to understand in that school age, now they're starting to figure out, is there a God? And we know that there's a lot of things with children about they feel that they got sick because God is punishing them. That's part of that understanding that there's something more powerful than them, whatever the name of that God is, because there's all different names. Now, do we have to believe in what a family's religion is? No. Do we have to respect it? Yes. And you only need to understand who you are. So first you examine who you are, and then you let them, maybe it's 6 or 8 prayers. Maybe it is some religions that sacrifice and blood, and I've seen things like that. Or it could just be the medicine man, the Indians. There's so many different faiths, so many ways of practicing, and our job, as long as it doesn't interfere with our practice, we let them. We give them J, all about how you think. So if you think of thinking as you have to learn the basics and build it up to learn more, as in, first of all, you find that you have hands, right? And then all of a sudden one slips in the mouth. And then all of a sudden you suck on it. And you go, oh, I like that. That is that building or grabbing a rattle. You grab it and then all of a sudden you shake it and you hear it rattle. Well, now I'm going to rattle, rattle, rattle every time I get that, right? And then, of course, it's going to go in the mouth because they want it in their mouth. Then it goes on now that they've built on these tiny things. It goes into secondary and tertiary type of things, as in, it could go into the magical thinking of brooms are going to be witches and sticks are going to be swords. It also goes into leaves have trees so they don't get rained on, and the animism and those sort of things. It's thinking, it's creative, it's magical in their brains, okay? Now, as we get into school age, is concrete. Again, concrete, solid. You can see it, touch it, feel it. They've done it before. They've had to see it practiced before. And then they can use that to practice it in another way. Now, get to adolescence. Now, adolescents have a way to getting whatever they want when they want if they're smart enough. I've told my class it's you have a child who's punished and can't go out on Saturday, and it's this big party, and they want to go. Well, what are they going to do? Because they were told the weekend before they can't go out. All week long, they're going to ace their tests. They're going to pick up their room. They're going to take out the garbage, help with dishes, make their bed. They're going to, whatever they know mom wants, they're going to figure it out. And that is formal operations. Figuring out something you've never done before and keep trying till it works. So that's the most sophisticated of all type of thinking. And now we have all the pictures that'll show more and more, and you can look at them. But I just told you all of that. Now play. Now, what do kids do from the moment they wake up to the time they go to sleep? They play, right? They're always playing. Why? Because they're learning. Their minds are thinking. So there are different words for types of play. Onlooker is just sitting there watching somebody else playing. Solitary, you're alone. I mean, you could be just sitting there coloring, right? That could be solitary. Parallel play is 2 or more children playing next to each other, but they don't share. This is absolutely toddlers, right? Me, mine, I'm not going to share. Parallel play is toddlers. Now, associative play, again, 2 or more children playing together, but they're sharing. They're working together, but just sharing. There's no goal. Nobody wins. There's no finish. They just keep playing. Cooperative play, and in that we consider the preschoolers as associative. Now, cooperative means they're working together, 2 or more, but there's a goal. It could be as simple as playing a game of checkers, or it could be building a house with blocks. There's a goal, something that they are going to accomplish, and that's school age children. Now, cultural differences, I came from a small town where there really wasn't a lot of culture. And I moved to Miami back in actually 1980, believe it or not, a long time ago. And what I've learned about is with culture, if you don't know it, understand it, it's not wrong to ask. And actually, the person with a different culture will be more happy to share because you cared enough to ask. There are things like Some cultures, you can't address them completely, only pieces at a time. There's cultures that male nurses can't take care of females or females take care of males. This is all part of culture. And just think about, diet, vegetarian, no pork, whatever it is, you have to respect that. And how do you figure that out? Well, if it's an older child, you're going to ask them or you're going to ask the parents, right? And again, it's talking about that spirituality, which is part of culture. Just know who you are and give them that ability. Now, assessing a child is different. It's not an adult. You're not going to do any head to toe, nothing. It will not work. So, how do you first of all get to a child to touch them without them screaming and yelling? Well, first of all, you walk in and get down on their level. I worked the last 10 years in an ER, and they'd be on a stretcher. I'd sit down on a chair below them. So now I'm not threatening. When I'm on top of them, I'm a big girl. I am threatening. But below them, I'm not anymore. Then I'm going to break the ice. I'm going to maybe I've always had stickers in my pockets. Give them stickers. Or maybe a older toddler, preschooler. Wow, you have a Spider-Man shirt on. I really like Spider-Man. Or maybe say, oh, my grandson likes him too, or my daughter, or oh, your sneakers got lights on them. Okay, so now I'm a pretty cool person. Then you could use play with a toddler. So where's your heart? Let's listen. Here, listen to mine. Let them touch, feel, examine, what you're using. And we know that some kids that using toys before procedures can help them not be afraid because they know what's coming. Now, infants, they're hard really to assess. If you have an infant quiet in a mother's lap or asleep, it is the best time to listen to heart and lungs because they're always and they're always wiggling, right? So it's the best time. And always from least to most invasive, as in a blood pressure would be last. I mean, and of course, after that, IV start or whatever. But, that blood pressure, they tend to be scared of. Always, look at the history, make sure that it does match what the injuries, if it's an injury, and always remember, as a healthcare provider, you're there to protect a child. I wish I had never seen any sort of abuse, but I have, and I've seen some pretty miserable things. So anything that pops your suspicion, remember, your job is to take care of that child. Now, conversely, let's say a parent brought in their child, let's say a 13, 12, 10-year-old girl, saying that they said their whoever touched them in the wrong place or did things. Remember, that parent is suffering. Remember the parent to give them, words to let them know, that you understand that, or you possibly mush housing syndrome. This is when a caregiver, usually a mother, will do things to make their child be sick. It could be putting urine in IV tubes. It could be wounds, putting stool or dirt in them, keeping them. I mean, I've heard some crazy things. Remember, if you have a mush housing suspicion, because the kid's always sick. It's not adding up. Why are they still sick type thing? Make sure that when they are there with a child, that somebody's supervising. And if they bring in things in, make sure that it is supervised so that they're not being hurt. Because again, that child is in your care. Now, growth. Nutrition, 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 right? Without nutrition, how is a kid going to grow? So it is the most important thing. If a child's not eating right, their brains aren't functioning. Their growth and development will be delayed. Not only will they be thin and underweight, but they're not feeding the fuel to the body, what it needs. So every visit on your pediatric child, all the way up to the pediatrician's office, as teenagers, the height and a weight. And you're saying, well, they don't do that on adults as frequently, do they? But on children, why? Well, we're making sure they're getting enough nutrition. Or is it a growth hormone problem? Or is a thyroid problem? Is something else going on? So that's why we know we will watch these children close with their weight. In the first year, double the weight at 6 months, and we will triple at 1 year. And if we see too little, too much weight, we'll either increase calories, we can increase calories in every ounce, or even breast milk, we can add fortifier, which is calories. So we can get their weight where they should be. We're feeding the tank, right? And then if it's too much, we're going to find out what we're which is empty extra calories, right? Now, adolescents, looking at nutrition, we know that body mass index is what we're going to be using, to look at their body weights. Now, all of these numbers, what they mean, how do you get it? It's not needed for the exam. What you need to understand is, what do those numbers mean? So they're saying that if you get into the 85th percentile, you're at risk for being overweight. You're there, okay? And at 95%, we know that child is obese. And we need to get an understanding why. Or if they're lower, why? Again, food diaries for all age children. If you're worried about nutrition on a toddler or a preschooler or a school age, get a food diary. What did they eat yesterday? What are they eating today? Food diaries, especially on adolescents. Adolescents tend to pick and run because they're so busy with their lives. Now, we do developmental assessments on every child when they are coming in to urgent care, ERs, doctor's office, into the hospital. And why? Well, children are resilient. Maybe they're not talking the way they should. At 2 years old, they're only saying one word, not up to 4 words. We are going to say, maybe they need speech therapy, early intervention. Maybe they're not walking what they should be at 18 months. Well, physical therapy, occupational therapy, early intervention, these kids up quick. And there's that early intervention program. In Florida, we do have one, and almost every state does. Now, cardiac assessment, when you get into capstone, you're going to have to know where these all are too, and it's going to be a refresh for you. And here's where they are located in your chest: the aortic, second intercostal space, just, for you to go down and refresh that. Now, an infant, many times they're cardiac, right? Week 5, we're going to go into that cardiac congenital problems. And we're going to have to listen to that heart really carefully and figure out what's going on. Whether it's the heart sounds or getting a heart rate, because we're going to give digoxin, right? Fourth intercostal space, left side of the chest, 1 full minute. And always we're going to listen to it. We're never going to take a radial pulse up till when they're later in age. And we know, again, sleeping babies, it's the best if we can get it. Now, breath sounds are all different. And children tend to have a lot of that upper airway mucus. So are we listening to breath sounds, or is it that upper airway type of breath sounds? Now, you take in between, your clavicles, that sternal notch right there. This can be a little bit of the upper airway. I always listen up here and then I go to breath sounds because it can refer and sound like bronchi down lower. Bronchiovesical, again, it's going down lower. Vesicular is now the lung area where you would listen to them. and this adventitious sounds, they could be, again, that revert sort of sound. Now, car seats. We know infants should be placed rear facing. They're actually saying in the middle of the car seat. I know most see them easy. Well, they're saying the middle is where they should be. Up to the age of 2, rear facing. Make sure that harness is snugly fitting. And younger infants, you might have to roll up little blankets around them and snug them in really tight. And that helps. So at 2 years, you can put them front facing, or unless their height and weight has outgrown the car seat, and then they could turn around. And that's just more. Don't ever use an expired seat, old seats, because they're not gonna, hold the child the way you want. So infants, I think this is all of you nurses, students looking at, oh my God, there's so much growth and development. What should I know? Remember, there's fine motor and there's gross motor development. So head lag is when you hold their hands, pull them up, and their head falls back. That should be at 3 months. They hold their head as they go up. Some kids are earlier. If it's 5 months and they're not, early intervention, right? We know that with SIDS death, they should be only on their back for sleep. No cohabiting, right? Not in the parent's bed with them. We know males are more, and cigarette smoke is also ear infections and SIDS death. So smoking should not be allowed around that child. They should roll from their belly to their back by 5 months, their back to their belly by 6 months. So by 6 months, you don't want that kid on a surface alone without being held or strapped in, because guess what? They're going to roll off and fall on the floor, whether it's a bed, changing table, couch, whatever. Make sure they're strapped in. When they're on their back, of course, they're going to get to the point they're exploring the world through their mouth, right?
I'm sorry, Professor Bogart.
Sure. Go ahead.
What did you say about the head lag, and like what is that, and when should they be doing that or not doing that?
The first thing they get control of, gross motor, is their head, right? They be able to hold their head up. Take a
Okay.
kid on their back, hold their hands, pull them up, and their head falls back. That's
Okay.
head lag. By 3 months, they should come up with your
Oh,
hand.
okay. So by 3 months they shouldn't have any more head lag.
No. So 4 months they have it. Again, maybe they need strengthening, physical,
Okay.
occupational therapy.
Okay. All right. Thank you.
Oh, no, you're welcome. So when they're on their back, we know they explore the world through their mouths. Their feet are going to go there too. They're flexible. We have the fine motor starts with that reflex palmar. And now by 3 months, they should have that voluntary. I'm going to grab that rattle because I want to shake it. I know it's going to do something. And then I'm going to put it in my mouth. Usually they say teeth start about 6 months, and it's 1 tooth per month. Now, not all kids get it at 6 months. As I've said to my class, they didn't have them till 15 months, and then they got 6 or 8. That is normal. They should be standing up, pulling themselves up, and standing next to a couch by about 9 months old. They should be able to sit with no support at 8 months. And not all children walk by 12 months, but they should be attempting to. All right. Colic is probably one of every parent's nightmare because they have all this gas and they cry, they cry, they cry. They'll put them on all of the air, gas drops. They will burp them, change formulas, sit them up after feeds, do everything, and they still have colic. It's just something they don't know completely why. Maybe it's the GI system is immature, but usually about 3 to 4 months of age, it goes away. But you can imagine, starts about 2 weeks, could last that long. These parents are going to be tired. It doesn't matter if you're breast or bottle fed. Now, We could say that happens, but let's say we're sitting at an urgent care doctor's office and a mother calls up and their 1-month-old infant cries all the time. Don't ever assume it's colic. That child, because they are very brittle, they're immunosuppressed, they have no resistance, it needs to be seen by a physician. Okay? Don't say, oh, sit them up, burp them well, get those little gas drops. No, that kid needs to be seen. So there's all different sort of definitions. Sequential is what they happen in sequence. They lift their head. They turn from front to back to front, right? This is all the way it grows. And we know that it starts with the head and then it goes up to 1 year where they're attempting that walk. Developmental pace is a kid does what he does when he's going to do it. And it doesn't mean that they never crawl. They go right to standing up because as long as they're moving in a forward motion on developmental stages, they're doing right. And those sensitive periods are times where they sit and they think and they don't move and they debate what's happening. And that is that sensitive period. Babies are born with fontanelles. Posterior in the back closes 6. Posterior, the one up here, is about 12 to 18 months. And why do we need to know that? Well, what if they're not there? What if they close too early? What if they're still open? All of those will need further investigation. Infants are born and they always look cross-eyed, don't they? And the reason is both eyes don't work together. Like if you put your finger out, your both eyes will try to do that depth of where it is, that depth perception. Infants don't have that. By 12 months, they say its vision is about what an adult is, but by 4 months, those eyes working separately start now working together. And then again, depth perception gets better and better as vision gets better. Now, pain. An infant is really hard. Are they crying because they're hungry or are they crying because they hurt? Infants have all different reasons why they can hurt. I mean, teething could be one, could be an earache, sore throat, all these things can do it. But what would you see? Usually an infant cries, they get the chin up and the little chin starts to quiver. Their eyes are closed and you'll see them thrashing and whimpering. And you can't console them. This is something that your infants do. Now, we know there's all pain scales. We know infants up to age 3 is the flack scale. And that's telling you the face, the legs moving, their activity, they're just moving, they're miserable, crying, consolability. So we know that this kid is in pain. Now, it's been proven by Harvard psycho therapists because I did a research on it. A little bit of oral sucrose, sugar water on a pacifier, or put them to breast will help in pain. You could do painful procedures with oral sucrose and a pacifier, or breastfeeding, like starting an IV, giving it an injection, those things. SIDS, as I said, excuse me, have a drink. Sorry, my throat. So infants who go to bed should be put on their backs. They have found that putting them on their tummies, there's an increased incidence of SIDS death. SIDS death is up to the first year of life. And what they found is a kid might vomit, then choke on their own, or they're in there inhaling their own carbon dioxide and they've died. We also found out that all those cute blankets and all those bumper pads and all that stuff, they shouldn't have. They should just be in a nice onesie or jammies that cover them to the degree they need to, but not overeating them. Again, no bed sharing. We know SIDS deaths increase with little or no prenatal care. And if they've had a cold, Remember, suck, swallowing, breathing is all they can do initially. Put a little mucus in there and it can obstruct their airway. Younger mothers, premature infants, and males. And they say formula fed, breastfed infants have less incidence of SIDS death. Now let's look at those reflexes. This is what we do when we test that growth and development. So grasp, we've talked about it. Steps, standing them up, they walk on their feet, right? We have that moro, which is also called the startle. You have a loud noise or you hit the crib, their hands and their feet come up real quick like that, right? And that rooting is when you stroke their cheek and they try to get there. Now, all of these usually disappear about 9 months, except Babinski. Just like adults, it stays there, okay? Another reflex is when you turn an infant over on their tummy to put them down, their hands and their feet come up. It's just like a cat, right? They're going to protect their heads. Same sort of concept. Nutrition for 6 months. Well, first 6 months, they should only have breast milk or iron fortified formula. And they say that milk should continue to 1 year. At 1 year, you can give them whole milk and they need the fat because of their central nervous system. They're still growing, they need it. When a baby is born, we know they're going to lose about 10% of their birth weight because they're soaking in fluid. They lose all of that. And we know a baby's getting enough nutrition from mom who's breastfeeding if she has at least 6 to 8 wet diapers a day. And if they're gaining weight every visit, we're doing good. And breastfed infants should get vitamin D. They need that supplement. When we start adding foods, it's right around 5 to 6 months. 6 months is what the book says. And we usually start out with rice cereal. It has the least allergy properties. There are other foods that children have more allergies, so usually starts with rice cereal. And it's one food at a time every 4 to 7 days. Check for allergies, rashes. It could be tummy pain, vomiting, diarrhea, all of those things. And the one thing, as we start feeding these children, infants, food, we might see it in their stools. I mean, just think about you and me. We eat a corn on the cob. We're going to see corn in our stool. Same concept, but these are different foods that infants will. Absolutely normal. They absorb and use as much as their body can. And one of the things that we can use as a milk alternative is soy-based yogurt. Again, that could be introduced at 6 months for a dairy alternative. Some parents want to do that to try to get them more weaned off of milk. Immunizations, first year. We know Hep B is usually given at the hospital, if not, first visit. And we know that we'll be continuing giving them. We know that they're given vaccinations 2, 4, 6 months, giving a lot of them. And influenza, this is, that big thing with all of that's going on with influenza and COVID, all of these viral things. We can't give influenza till 6 months old. And the one thing I think parents are the most concerned about is that these children are going to hurt because it's usually like 4 different shots, right? So using a topical anesthetic can help. Also, breastfeeding, sugar pacifier, these can help. And we give all first immunizations into their vastus lateralis, into their thighs. And that's the schedule from your book. Toddlers, we know infants are born with their heads big and the chest is little. By the time 15 months, they should be equal. If they're not, we need to figure out why. Now, I told you about approaching a child, and we know that we start with getting down, getting on their level, and then again, from least to most intrusive, and let a parent hold their child. It's less threatening when they're there, right? Pain in a toddler, we know it's flack. What do we see? Well, a kid who's in pain, maybe it's an earache or throat ache, they're going to be crying and you can't comfort them. They're going to be sitting in the corner, they're not going to be playing, and they're usually not going to eat that much. And you're going to say something's wrong. So flack, as I said, all different, faces, legs, activity, crying, consolability. But remember, we can give, let's say, months old or acetaminophen, but that's not all we do. It could be distracting them with music, turning them, music, infants, massage, all of these distractions used with pain medicine make it even better. And they'll have less pain, which is atraumatic care, pediatrics. Older children, you could do hot packs, cold packs. Sickle cell children like either hot or ice packs. They all depend. Again, repositioning distraction. And if we're giving something for pain, if we have an IV, let's give that pain medicine. If it's something we could give IV, give it IV. We don't want to cause undue pain. We have intranasal, we have IV, and in the mouth, orally, is better a lot of times than giving an injection. But if we have to, again, we can use topical anesthetics. We could use a pacifier, sugar water, or breastfeeding for youngers. Now, toddlers. What you need to know about toddlers is by this point, head and chest should be the same, and they're growing slower. They're growing about 2.5 years is when they get 4 times their birth weight. So they really slowed down. We sort of think at this point they're eating like crazy as infants. They're eating so good, you're so proud. They become toddlers and they don't eat that much, but they're not growing. So, do they really need to eat that much? We call it physiologic anorexia. And they're picky now. They're choosing what they want to eat. They can taste better now. As infants, they don't. Toddlers are starting more refinement of their movements. That walking, which was waddling, is becoming more mature. They're using both hands. They're throwing balls. They're getting more robust in their movements. Again, social, they're parallel play. Again, they don't share, right? Playing next to each other. By one, it's one word, mama, dada, right? By two, multi-word sentences. I want milk. I want whatever. And they are learning how to do things for themselves. And they want to. They want to dress and undress. They do get to the point of toilet training. And as I said, and all ages are different. The book says 19 to 24 months, but all kids are different. Bowel is before bladder. That's the important thing. And those 3 signs of potty training is they have to know about, I need to go poopy mommy or whatever. They need to understand what it means to hold it to get to the bathroom. And they know that when they're done doing what they need to do, usually mom goes, yay, that's that satisfaction, that reward. Now, as I said, toddlers, terrible twos, these kids are in everything. Mimi, my temper tantrums, and for discipline, it is a timeout. 1 minute per year of age. Now, one of the things that children do is everything in their mouth. And toddlers are explorers. So anything that goes in their mouth that could be a poison or medicine or whatever, call poison control. We do not induce vomiting anymore. We don't use Epicac. we call poison control. They tell us what to do for that child, and then they get them to the appropriate care facility. Preschoolers still slow in growth, height and weight still the same. They're finicky and picky eaters, and they just like the foods they like. Could be that child is macaroni and cheese, chicken nuggets, apple juice, right? Or it could be a child that likes only salami and cucumbers and broccoli. I mean, all kids are different, but they like what they like, but the variety's a little bit more. Again, Colbert, what did I say? Preschoolers, they understand right, wrong, and they understand punishment, that consequence, and reward, the other consequence for being good. They're starting as these toddlers, preschooler, when somebody don't feel well, they go over and kiss and they'll say, all better, right? So preschoolers are all about the ages of band-aids. They think once they're cut and they're bleeding, their insides are going to come out and they're going to die. This is what they do think. So put a band-aid on it and it's all better. Now, as I said earlier about spirituality, even on preschoolers, they think that I hit my sister yesterday. That's why I have a tummy ache today. That's why I fell off the monkey bars and broke my arm. It's because I did something bad. It's not to God yet. It's still say I did something bad. Pain scale at 3 up to age 6 is your FACES scale. And they use it really well. And the best thing about kids, they give you a real reading. Some adults are will show you exactly. Gross motor skills, now they get more and more refined as they get, up in age. At 3, they can balance, walk on a line, skip and hop. Tricycles are good at this, and they can jump with 2 feet. At age 4, they're starting to be able to stand on 1 foot, on tippy toes, hop on now 1 foot. They're jumping now. They are jumping over hurdles, and now they're running all over the place and they're not falling down. Now, the one thing you need to remember about this advancement in being more agile with their gross motor, the running, skipping, and jumping, this lends for preschool children to be more aimed to get into accidents with motor vehicles, running out to the street, chasing a ball, going to the next door neighbor, grabbing something, or riding a bike behind a car. They don't see them getting run over. Motor vehicles is the biggest area of unintentional injuries in all age children. By age 6, they can ride a bike, they can jump rope, and now they can play hopscotch. So again, we know that if they ride a bike well, they feel good. That's their industry, right? Jumping a rope, that's industry. They feel good. And playing hopscotch. You would not give a kid an activity at this age, something they could not achieve, because it would make them feel inferior. Industry versus inferiority. Fine motor skills, we know that children about 4 and 5, they're buttoning their shirts, they're coloring inside the lines, doing circles, they're threading things on ropes, and they're building things, cars and trains and tracks and all of that, all with their hands, fine. Preschooler is the age of getting them ready to go to school. And it's the parents' opportunity to read books and make them feel good about going to school. They should be in some sort of programs that puts them with groups of kids, whether ballet, whether t-ball, gymnastics, a reading group at the library, whatever it is, church, Sunday schools. puts them in an area where they have to learn how to get along with other kids and share, right? And the attention span is about 15 minutes at this time. We know that there's a lot of communicable diseases with kids. They share all the time. Chickenpox, yes, we do have an immunization, chickenpox. Now, as a healthcare provider, if you see a child who's got a fever, who's got these macules and papules that are oozy, juicy, itchy, burning, suspect chickenpox. The first thing you need to do is protect yourself with that N95 mask. And that kid, because usually there are immunosuppressed kids in the same area, put them in an isolation room. Now, many parents say, that prodronal where you don't know when you're getting chicken pox, they don't know yet. It's like about 4 days before the rash breaks out. Now, you can't really prevent that because nobody knows that it's coming. But when does a kid go back to school if all of this rash? It's when all the lesions are crusted and dry. The time is different for all kids. Common colds, conjunctivitis, pink eye, diarrhea, a lot of these are viruses. And again, they just take time for them to, for that infection to go away. It's treated ibuprofen, acetaminophen, fluids, and rest. I've mentioned neglect a little bit. There's physical, sexual, and emotional. What we need to look for is when we look for things that don't match what the injury does not match what the parents are telling you. There's something there. So always make sure that we're looking for it. And, always we're going to be educating parents, educating. It could be just naivety. They don't know a parent, and it can be that. But again, try and educate children and parents. And again, remember those parents who have a child who they brought in because somebody else is doing something to them. Nutrition in preschoolers, we know they're going to eat what they want when they want. They should have about 1,200 to 1,400 calories a day, which is quite a lot. They need protein, that 13 to 19 grams. Remember, what is protein good for? That's wound healing. What are preschoolers doing? They're falling down, skinning their knees, right? Their elbows. They need it to be able to heal those wounds. Also, calcium. They're growing. Their bones, their teeth need it, okay? And remember, nutrition fixes a lot of underlying conditions. Think about iron deficiency anemia, which is one of the examples. You can add food into their diet, which gives them that iron that they need. And they're not going to have to take that iron medicine, maybe, right? So, what about green leafy vegetables, eggs, meat? They're very high in the iron. And school age. This is all I want for Christmas is my two front teeth, right? Age 6. It starts with their teeth coming out. It ends up with puberty and all their permanent teeth. It's amazing how quickly they grow. That Piaget, one of the things with understanding that he says is that they understand conservation, which is just you put 10 pennies straight up next to each other, or you mix them all over, it's still the same thing. You take a glass of milk that's in tall, skinny, and put it in a short fat, and it fills it up to the top. It's the same amount of liquid, but guess what? Preschoolers want that tall one. They think it's more. The small one, they don't. And that's what that means there. Again, Erickson, same-sex peers. Kohlberg is all about pleasing everybody. Again, they grow slowly, but you're talking ages 6 to 12. They'll double and increase all of that a lot. And boys and girls in this time are basically the same size, same weight, same height. Injury prevention, protection is so important. Children are now more active. They're riding bikes, they're playing sports. Motor vehicles, again, making sure that we're keeping them safe. Um, we know latchkey kids, they're coming home into an environment. They, nobody's home. They have a key, they let themselves in. We know that can be a high level time of injuries for children. Water safety, so important, especially like me, you live in South Florida. I told my group, my grandson, I have a pool in the backyard. At age 2, without swimming, would do front flips in the pool. Now his little head be like this, swimming above the water, but he knew how to keep safe. He knew he couldn't go in without asking. So water safety should be always promoted. Rear vehicle seats until they're 13 years old, and booster seats they should be until they're 8. This is the recommendation. Of course, using bicycle helmets, and then, of course, using all sorts of um, elbow pads, wrist pads, knee pads, shoes, whatever it is. And, we have the Everglades, like a mile west of me. And a lot of kids ride these ATVs, these three-wheelers all over. Now, it is recommended kids less than 16 should not be a mile away because that's what will happen. And what are they going to do if they lose direction and how are they going to get out? They feel they need an older child to do that. And trampolines are really bad. Now, preparing kids for procedures, and it depends on how old they are, doesn't it? If they're 6, we need to say that X-ray is a big camera looking at your insides. I always show them the X-ray of broken bones so they can see it, right? And they know what that X-ray looks like now. Older kids, you might can say X-ray. Again, understanding your child. ADHD, common in young kids. These kids are distractible, inattentive. They go from one thing to the next thing to the next thing. Some people say, well, this must be all child being spoiled, doing what they want. It could be ADHD. A school nurse, in this case, should bring that parent in and develop a plan of care. Many parents have tried many things to try to help their kids focus. So first listen, then make your plan of care. Older school age and adolescence depression. And how would you know a kid is depressed? Well, all of a sudden they're isolating, right? They're sleeping more or sleeping less, eating more, eating less. They don't want to go anywhere, do things. Now, children do commit suicide. So if we're seeing these depression type of, things, symptoms, we need to make sure that these children do get care. They just feel like nobody listens, nobody understands, right? Dental health, remember, all their baby teeth are coming out. We're getting permanent teeth back in, making sure they brush their teeth, and flossing is really important. Remember, kids, up to like first grade, they don't have dexterity to do it. So parents should help. But parents should floss for them. Fluorinated toothbrush, soft bristles. And when we see teeth falling out, it does not always mean that it's poor dental health. It could be the teeth are supposed to, right? But if it's pain, we know that that's the problem. That could be a cavity. Chicken pox. I just said it. What do we see? What do we do? How do we take care of it? Again, that's just the reiteration of what I said before. You might see. When would you see this? This would be a parent who gives aspirin to their child for a fever at home. If you have had a viral illness, a common cold, influenza, viral pharyngitis, and you give them aspirin, it's the possibility of Raynaud's syndrome. So we never ever recommend aspirin. When we get to week 5, you'll hear that one diagnosis that we should give it for, okay? So any kid coming back from any viral anything, chicken pox, whatever, never aspirin. So, adolescents. This is the group. They're hard to talk with. How do you open up and get into their minds that they'll talk to you? Well, we know that they're all about figuring out who they are. And mom and dad just don't understand. They're testing boundaries, fighting for independence, and they're worried about body images. Who am I, right? What am I going to be? And again, remember, negative self body image can lead to depression, can lead to suicide. So it's something that should be talked about. We know that unintentional injuries, number one is car, but it could be suicide and homicide in those adolescents. Nutrition. Now, as I said, they're grabbing and going, aren't they? Again, if we see an adolescent too skinny, too heavy, again, that 24-hour diet of food can really help. We know that there are some eating disorders, anorexia, when you don't eat food at all and exercise like a crazy person to burn calories and only drink water. Bulimia, you eat food like crazy, but you vomit, vomit, vomit. What would you see in the difference? Because of the stomach acid. And that's usually the thing, the clue. They should have their HPV vaccines. We know it's a 3-dose series. It's given to girls and boys now. And it starts about age 12, 13. Sometimes it's 9. It all depends on the physician, but this is to prevent cervical cancer in the future. Gaining their trust, difficult. I like to see, what are they wearing? Yes, Paul, you have a question.
Yes, ma'am. The HPV vaccination. Do males get it also? Boys get it also?
They're giving it to males now too. Yes,
Are
they
they?
are.
Okay. Awesome.
Yep, because they're transferring it to the girl, right?
That's what I thought. They're the ones that kind of are the carriers. I didn't know if males are getting it as well, or is it just females? But both are getting
Both. HPV has been found ineffective for males 9 to 26. Yes, sir.
awesome.
Thank you.
Thank you.
No, not a problem. So again, getting into an adolescent's room, you're not going to sit below them. Oh, would on a younger child, you would say, hey, you're listening to music. What music do you like? Maybe you know who they are. Oh, is that rock? Is that pop? Who is that? Oh, or my daughter listens to that, or something. Or they have a New York Yankees t-shirt on. Oh, I love the Yankees. Now all of a sudden you're not threatening, are you? You're looking at them, recognizing them for who they are, right? And if we need to, get the parents out of the room and they will talk to you. And the thing is to listen and be prepared. They will tell you stuff that will shock you. Don't react, okay? Be prepared for it. So you build up that bond, you can get that information, and then all of these urinary tract infections are because they're sexually active, but they don't want mommy to know, okay? You don't have to tell mom anything they said unless their behaviors are going to hurt themselves or others. Now, adolescents are going through that big growth spurt, aren't they, in the beginning? That 20 to 25% in those 2 to 3 years. So they're growing really quick. Well, what did we do for infants as they're growing? Nutrition, 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 right? Well, and rest. Adolescents, number one, aren't eating the way they should. And number two, because of their schedules, are not sleeping the way that they should. They need more than they can get, okay? They're going through puberty. They're going through that identity. They're going through school, trying to get into college, in the sports, want to get a sports scholarship, all of this stuff. Sleep deprivation is what they get. But we should tell them, please make sure you get enough sleep. And you're seeing 14 to 17, a minimum of 8 to 10 hours. Many of them don't get that. I've already talked about depression and suicide, but just, reiteration, what do you see? Again, that's identity, what they're going through. It's a hard time for them. They feel lonely and they feel isolated. There could be all different things that put and tips them over into suicide. It could be their family, the environment they're living in. Could be, hereditary. Other people in the family committed suicide, or maybe there's some sort of abuse going on. So, whenever a child tells you they feel like killing themselves, take it seriously. Get them help. Now, Tanner stage of development is a model which shows you what you look like, what you would see. All right. As in a girl, first thing that you're going to see, and that's stage 2, is breast buds. And stage 5, as they mature into that adult. When you talk describes the developmental stages. Now, one of the things with growth and development and going into puberty and menstruation is girls usually start that changing, and 2 years later is when they get their menstruation. Okay. Girls now are menstruating, they're going through puberty, and they're gaining 25% of their height, right? They're gaining weight, gaining height, and all of this stuff here makes them have irregular menstrual cycles, and they're extremely moody. It's hormonal. You'll hear brothers say, yeah, she's got her period again. That's why she's so nasty. And I had 6 brothers saying it all the time. So it's that girls, because of all those things, are a little miserable. Now, there are videos that I've posted here. If anybody wants any of these worksheets, if any of you miss one math question, it's 2 points. There's 10 points on every exam that you're going to take. If you need help, I don't care if you're in my class. I don't care if, you're already in capstone. You need help with math, let me know. I can teach you in 15 minutes or less. You just have to first look at that RN review, and I will help you. I'll make it simple, but I don't do ratio proportion. I think it's too much crossing on and crossing off. I just give what, but I can teach you what are those things you need to make that problem work for you, how to pick out what's a distractor. Okay. Anyway, guys, good luck to you all. I wish you the best. Again, if you need anything, let me know. On Luminoso, I will give you that PowerPoint. In fact, let me do something right now for you. I'm going to post it in the chat box. All right. I had to go through it, give it for me in order to do that. All right. Which one? Oh, stop.
I apologize for being late. It was the last.
Oh,
I had to
not
go
a
pick up my
problem.
children.
Listen, I understand life. Remember, I live a life too. So I really, I understand it. And, I went back to school for my BSN, MSN, PhD after the age of 53. So you're talking about somebody who understands life and what shows up, and you got to do the best you can do. And that's all you can do, isn't it?
Yes. So how do we just look at those YouTubes and that's going to help us, or do we get information from you to be able to get those the teaching for them? I get the fluff and the problems really get to me.
Well, Tina, make an appointment with me.
Okay.
So
Now,
when do you take your exam?
For next Wednesday.
Next Wednesday. Let's do it next Tuesday.
I'm
Can
in
you Tuesday?
I'm in clinical next Tuesday, and I
Next
have
Monday.
Sims next Monday. I have Sims next Monday
Tomorrow.
morning. Tomorrow morning.
I would have some things in the morning.
Thank you, Professor. Thank you for your time.
You're absolutely welcome. Absolutely welcome. Thank you, everybody.